for the Employee Equalities, Diversity and Inclusion Forum of 28th May 2025. We have present in the meetings Councillor Brogan, Calicis, Clark, Cowie, Ferguson. We don't have Councillor Lambie present. We have present Councillors McClyman. We don't have Councillor McGeever present. We have present Councillors Razak and Robb. We also have various officers and trade union representatives, and I'll hand back to the Chair. Thanks.
Thank you. Can I have any declarations of interest? No. Okay. 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 And minutes of the previous meeting held on 12th of March, pages 3 to 6. Any questions? Can I move the minutes be approved? Yes. Okay. Second. Okay. Thank you. My agenda item 3, council-wide workforce monitoring, pages 7 to 28. Can invite Elaine Maxwell to speak.
Thank you, Chair. Good afternoon, everyone. So this is the council-wide workforce monitoring report, and that covers the period the 1st of January to the 31st of March this year. As you will see, section 4 outlines the absence statistics for the council, and you'll see that at that time, based on March figures of 25, the council's absence rate was 6.8%. So that was shown as a slight decrease from the previous month, but certainly was also shown an increase compared to March of 24. Continuing theme in terms of the main reasons for absence, and you'll see that it's recorded that psychological and musculoskeletal conditions remain the top reasons for absence across the council. And the number of days lost across the council have increased, and that's primarily due to the psychological and musculoskeletal conditions as I've outlined there. Section 5 goes on to detail the occupational health information for the council, and you can see that 528 employees have been referred for a medical examination, and that again has also increased from the previous year. 496 employees have attended physiotherapy, and it's noted that 70% remained at work whilst they were undertaking their treatment, and there were 589 referrals to the employee support officer. From the information that we gain, most of that is for personal reasons. Counselling services and those referrals that have been referred to our PAM Assist provider, you'll see that there were 222 referrals made during that period, and we had 55 referrals for CBT. Section 6 then goes on to outline the accident and incident information across the council, and we can see that there were 379 accidents and incidents reported, and there were 164 that have been investigated and categorised, and you will know from other attendance at committees in terms of that process to make sure that accidents had been properly categorised in the right area. Section 7 then details the discipline, grievance and dignity at work information, and there were 49 hearings held during this period, and action was taken in 47 of those cases. There were 4 grievances raised, with 1 being resolved and 3 that remain in process at the time of the report being completed. There were 12 dignity at work complaints raised, and they're all under investigation again at the time of the report being completed, and there were 2 referrals submitted for mediation. Section 8 then goes on to outline leavers and exit interview information, and you'll see that there were 100 leavers eligible for exit interviews, showing a turnover rate of 0.6%, and there were 15 exit interviews conducted, again showing a decrease from previous year. Section 9 goes on to detail the recruitment monitoring information for the council, and you can see that there were 3,216 applications received, and there was a detailed analysis of the equal opportunities forums that is broken down in the report for you. And again, the number of appointments and the breakdown of appointments, both for our disabled applicants, our black and ethnic minority applicants and veterans, are also detailed within the report. Section 10 goes on to detail the staffing watch information and reports that there was a decrease of 97 employees between the staffing watch information collated at March 25 in comparison to the information collated at December 24. 4. And with that, I would refer you back to section 2 of the report and ask that the committee note the information. Thank you.
Okay, are there any questions? No? Ross?
Thank you, Chair, and thank you to Elaine for that report. I realise some of this might have been covered in this morning's executive, but I'm looking at the attendance statistics and in particularly I note the increase of total days lost due to both psychological and musculoskeletal conditions, managed to say that okay, and the kind of corresponding statistics on Appendix 8, kind of in two parts. First of all, is there kind of any reason that we've seen for those increases? I imagine a lot of the psychological conditions might relate to work-related stress, I imagine. And then you kind of go on to the next section. You mentioned about referrals to PAM Assist and how that's kind of dropped slightly with psychological days lost to psychological conditions increasing. You would kind of expect that figure to also increase for that, and because I do note that the referrals to CBT have also increased. Is that been kind of a conscious decision to encourage more referrals in that area? And does something need to be done to encourage more PAM Assist referrals? I note that many of these are self-referrals.
Thank you, and I'll try and cover all of your points. There was a few bits in there. So in terms of the psychological absences, and I think the question was around, was it all related to work-related stress or work-related issues? There's a variety of issues that are reported to ourselves. Sometimes it's not just one issue, it can be a variety of different things, whether it be, things happening at home, some personal circumstances, bereavement. There's a number of factors that link into psychological, as well as there can be issues related to work, that we deal with. So it really just depends on how someone is presenting, and sometimes actually some physical illnesses can manifest itself in terms of psychological. So it is about how somebody's reporting, and we have to actually put that through. And you'll know that our psychological category covers quite a number of different breakdowns within there. Certainly what we do is we just make sure that we are recording and reporting and picking up and dealing with those cases. And we've got quite a robust mechanism for doing so. We work very closely with our trade union partners in terms of actions and activity across that area, as well as our resource managers. And what we have done recently, I suppose, which covers all of the absence, is around trying to provide more bespoke training and more bespoke support for our managers to deal with complex and difficult cases, because we realise that a number of employees have a lot of complex issues, or can have some complex issues on there, and it's just about where and what support that we can provide. What we also do is we try and regularly give updates. I suppose I'm going to jump about a wee bit, apologies, around our making sure that people are aware about PAM. Now, we can't enforce people to take up that. So in terms of the employee counselling, in terms of our officer that works for the council, contacts everyone who has got a recorded psychological absence. So she will have that conversation with everybody that has gone off sick that falls into that condition. Not everybody will then access PAM, and also some people that are accessing PAM may not necessarily be off because it's available to everyone, in terms of being able just to pick up, even in the moment crisis support is available. So, but we are constantly trying to put those reminders out, making sure that we are letting everybody know. And if you've been to any of the other committees that I've been on, you'll have heard me talk about some bespoke work we have done within our facility services, the hard to reach areas where we've had them in to the building for a day, got people from a number of different areas of support to be able to reach out to those employees, and that's something that we're going to continue to do. And we're trying to see, right, okay, for other hard to reach areas, you know, the big issue around education, you know, how do we reach out to those employees? You know, it's not so easy for a teacher just to say, right, kids, can you just wait 5 minutes to go, and I'm going to go and pick up and I'll attend that webinar. So doing quite a lot of things, and hopefully you'll see through some of the circulars or the global emails we send out that there's that constant reminder. So we're trying to just make sure that we continually to review that, and we've got quite a big piece of work ongoing just around that. In terms of our musculoskeletal, unfortunately, in terms of some of our ageing workforce, the frontline nature of the job that they're doing, you know, or even those that are sitting down, you will see that you know, comes hand in hand. So again, in some of the areas where you would traditionally see the absences around that, and that's where we would encourage access to the physiotherapy service. Or again, but if an individual's getting treatment from their own provider, that may not necessarily be the route that they take. So for each of those, what we try and do, you know, is make sure that we've got the appropriate supports that are being put in place. On the stress, or the workplace stress, we have a stress risk assessment tool that we can also use, and that then creates, you know, it's like an questionnaire for the employee to go through, and the manager participates, and what comes out of that as an action plan in terms of how do we get from here to support an employee coming back to work as well. So there is loads and loads of strands, and I probably could speak for such a long time on it, and it would take me all of the allocated time, but happy to provide any other information on that. And the other question I think you'd asked was around the CBT referrals that have gone up, and perhaps the reason for that. Because our occupational health provider and PAM, what we are seeing is probably a bit more of an assessment in terms of some of those counselling requests or referrals actually being directed for CBT, because that's been seen as a more appropriate course of action for that individual rather than your normal counselling. So it's something that we have noticed in terms of that increase to CBT across the resources, so not necessarily, you know, one specific area over another. And hopefully I've covered all of the points, unless there's anything else that I've missed.
Okay, next one up is Tony Slavin.
Thanks very much, Chair. And it's just to sort of, it's not really a question for Elaine, it's mainly just to back up a lot of what she was saying. I'm the representative for the JTUC, and I'm working on policies with Elaine, but what I can see is the importance when, whether it's workplace stress or stress coming from the home, we have an early intervention officer who contacts the employee immediately, and then decides, well, they try to work out, and she does encourage to get in touch with PAM Assist. We also have a wellbeing officer, Suzanne, which helps and does global emails and global management or personnel bulletins that also help. And just to say that the stress risk assessment tool is a great thing, because the union gets involved and sits with the employee and helps them to go through it and assist them in filling it out and to identify an action plan going forward, and that's really good. Also, we're working on the agile working policy, which has a very beneficial effect on people with disabilities, which means they can manage their disability a lot better when they're working from home. So all these things together, working hand in hand with the trade unions and our partnership that we've got through the JCF with elected members, but also the JTUC working with personnel, is a great backup and a great capture for people who have unfortunately had to are off with some stress. So all in all, it's just to back up what Elaine was saying. and to see that work together is effective in helping the employees who find themselves in stressful situations to get back to work.
Okay, thank you.
Thanks.
Thank you. Are there any more questions? No? Okay, this is for noting. Thank you very much. Agenda item 4, social work resources, workforce monitor, pages 29 to 36. Can I ask Elaine Maxwell to speak to the report, please?
Thank you again, Chair. So similar to the last report, this report focuses on the information specifically for social work resources and covers the same period, the 1st of January to the 31st of March. Outlining again, you'll see section 4 details the absence rate for the resource, and you'll see for March 25 it was 8.6%, so that is a slight increase from the previous month, and as you can see is higher than the council-wide figure. Compared to March 24, the absence rate has increased for the resource by 0.7%. The annual average, obviously because it's March, we can see the annual average rate for the resource was 8.1% compared to a council-wide average of 5.9%. And I suppose probably touching on some of what I've just previously said around the activities that are going on across the council, there is a specific focus within social work resources as a result. Section 4.2 then details the occupational health information, and we can see there were 406 referrals for medical examinations and physiotherapy over that period, and showing an increase from the previous year. 4.3 details that there were 19 accidents and incidents across the resource for that period, with a slight decrease from the previous year. Section 4.4 outlines the employee relations activity, and we can see that there were 15 disciplinary hearings held, 1 grievance complaint raised, which was an unchanged position from the previous year, and 8 dignity at work complaints raised compared to that there had been none in the previous year. Section 4.5 shows the analysis of leavers and exit interviews, and we can see that there were 15 leavers eligible for an exit interview, and 1 exit interview was conducted, which is obviously a decrease from the previous year. You will be aware that we do try and encourage exit interviews, but because it's a voluntary process, it can be quite difficult to try and get individuals to engage in that. Section 5 then details the staff and watch information, and we can see that there were 22 employees, a decrease of 22 employees from December to March 25. And with that, we just refer the forum back to section 2 of the report and ask you for the information contained in the report to be noted. Thank you.
Thank you. Are there any questions? No, there are none. So can we note this report? Okay. Next one is agenda item 5. It's annual report on mainstream equalities and diversity, social work resources. It's page 37 to 52. Can I ask Martin Kane to speak to the report, please?
Yeah, thank you, Chair, and good afternoon to the forum. This report obviously covers quite a lot of detail just around social work's contribution to mainstreaming equalities and diversity. I'll take you through the strategic element of the report, and my colleague Bernie will refer to the interesting bit at the back that shows the actual contribution of the resource and gives some good examples of where we do make that contribution. So social work, as everyone will know, is a targeted service, and by dint of the very people we work with, those people are very much at disadvantage. So a lot of what we do is obviously focused on making sure that those individuals have the opportunity to access services and are protected from harm and abuse. Just section 3 of the report, picking up on where social work does play into this. In a council plan context, we obviously meet 3 of the 6 council plan outcomes, and they are health and wellbeing, children and young people, and communities and environment. And you'll see there, just as I've outlined previously, that our biggest contribution is around that statutory element in line with the Social Work Scotland Act. Just turn to section 4 of the report. Social work, as you'll be aware of, has a huge contribution in terms of partnership work, and you'll see just under 4.1 just some of the partnership areas we work in. So we don't just do this work in isolation. We do this with in conjunction with a range of other partners. Section 5, which is a section Bernie's going to focus on, shows the contribution of social work to 4 of the equality outcomes. So what Bernie will do is pick out some of the areas that we think will be of interest to you. So we'll not go through them all. It will just be a selection of them, just to give you a flavour of what those are. So I'll hand over to Bernie just now, just to take you through that.
I was going to say as well that we'll not be concentrating on the, there's a whole page and a half, I think, devoted to the technical enabled team, and you're doing a presentation, so we'll miss your paragraph and a half in this report, if that's okay. I'm just kind of drawing your attention to some of the equality duties we have in terms of delivering under the Equalities Act in terms of our workforce. We deliver training courses to employees in terms of equality and diversity awareness, marriage and civil partnership, unconscious bias and race discrimination, all to do with the Human Rights Act and protected characteristics and the legislation that follows that. And you can see there's quite significant numbers of staff on the social work payroll, but also the numbers of staff that are put through those courses year on year. In terms of interpreting and language lines, like a lot of our customers are from other countries, and maybe you'll detect a bit of Irish in my accent, so I'm one of those protected characteristics as well. So language line has grown over the years with the number of new languages that are introduced. The council front end of our web page gives access to numerous languages if people want to read our information in other languages. But this is just a snapshot of some of the languages that social work have used this year for interpreting services. We've also had a British Sign Language plan signed up, the BSL plan, and there's been 17 occasions when people have used that this year. And we've recently started to put BSL signing on some of our web content as well, so that people can not just read in another language and see all the narrative, but there's kind of sign language images being put up now via YouTube links, which is really, really a positive step forward. In terms of older people, and the outcome talks about nuisance calls, but also protecting older people and people in the community in general. One of our mainstays is the Adult Support and Protection Committee that deals with abuse and harms that older people face. So there's some interesting statistics there quoted for the number of ASP investigations that have followed through, and I think there was a joint piece of work done with North Lanarkshire Council in terms of the prevalence of harm, the financial harm particularly. So there's been some work done in those areas. We've linked in a wee paragraph here about counselling in schools, because some of our young people in care will avail of those services. They're kind of mainly funded through education resources, but there's teams where our young people in care can access services as well. In terms of improving health and well-being for the most vulnerable in our communities, we talked earlier on about social works legislation and who we support. There's a range of flavours of different services listed there, from assessment and care management that have that conversation with somebody that comes in the door in the first place, seeking a bit of help, to home care assessment teams as well that kind of recuperate and re-enable people that have maybe been in hospital, had an injury, need to get back on their feet quite quickly. So some of our services are very good at doing that. We go on to talk a wee paragraph there about in intermediate care. And there's been some nice wee case studies here where people experiencing the service give you their wee flavour of how they felt it's changed their lives and kind of got them back on their feet very, very quickly. So that's a great sentiment for what's going on in Blantyre Life and the reablement services. And there's a good wee quote in there about somebody that's buying all those Alexa models. We're publishing, or we're publicising Amazon here, but how those tools and techniques are assisting people now. I'm skipping over 5.1.44 and just jump into the care and support service, dedicated service run by social work for folk with moderate learning disabilities living and supported in the community. A small service, but keeps people independent in their own homes. We have a couple of paragraphs in here referencing carers. There's one that talks about delivery of the Carers Act. But generally, carers we're supporting through a range of methods with our commission services and work that's happened through following out the duties of the Carers Act. And maybe just to kind of highlight, in a week's time, or not a week, it's the 9th to the 15th of June, Carers Week 2025 comes to South Lanarkshire. We'll be flying the flag outside the building, we hope. We hope to have a bit of an event. But this year in particular, there's a focus on employee carers in the workforce, like both the council and the NHS board employ many people that are carers in their own right. So there's an event happening and there'll be different public information going out with the help of personnel during that week that'll kind of raise awareness to people that are carers in the workplace and still have to do a job of work as well as care for somebody at home. We've also procured some new service providers now, care at home and also adult supported living for folk with learning disabilities that live in the community. That's two big major pieces of work, that frameworks that need to be reviewed every couple of years on a rolling programme so that new providers can come in to that procurement exercise if they wish. So there's two new lists and that's all available on the council websites for anybody to see, people to kind of pick up if they need to know what services are available in their areas. There's other references here to particular services, that the autism service, again, particularly support to children and young people with autism and the parents and carers that use that service. We've got a range of work that goes on in our justice world, and within the report there's references to some of the CPOs, the community payback orders, or the unpaid work that they undertake down at Auchentibber. And recently there's some interesting conversations with the team down there as how they communicate with some of the folk that come in to the scheme to do some unpaid work, because they haven't got Google Translate on their phones. We're not allowed to use that, so we're kind of trying to negotiate, well, how could we use some Google Translate down in unpaid work with some of the guys that come in to with an order to kind of even to do health and safety checks with them. There's a lot of work involved there in kind of getting that done. So we're looking at new ways of kind of communicating with folk through those our justice services. In terms of the Caledonian programme, that's all linked to gender-based violence and work with men to kind of educate them and kind of respecting women, etc. So there's lots of work going on with Caledonian with groups of men, and there's programmes running with young boys groups as well to kind of look at how to respect women and to avoid violence, etc. etc. Wassler, which is Women's Aid South Lanarkshire and East Renfrewshire, is one of our commissioned services for domestic abuse. They're part of a kind of wider partnership group, which is the Gender-Based Violence Partnership, that's kind of driving forward the Equally Safe strategy, a national strategy about domestic abuse and violence. So that kind of group's kind of working through their working plan to make sure that we're supporting women in those particular situations. We've references in here to independent advocacy at 5.4.15, and we've also referenced to independent advocacy in 5.1.4.23, the ADP, because ADP commission independent advocacy as we also do in the council, and that's advocacy that's provided under the Mental Health and Treatment Act, where people with mental health disorders, dementias, learning disabilities should be permitted access to independent advocacy in any part of their life. And kind of finally, I'll mention the family support hubs. They're new and fresh in South Lanarkshire, maybe 2 years on the run now, and they've changed the lives of child and family services in South Lanarkshire, and changed the lives of families feeling that social work's more approachable. They'll kind of come to the hub stores rather than kind of come to local offices. So that kind of myth that social work, you know, aren't that good, it's changing that whole myth, and the family support hubs are doing a wealth of jobs out in the community, and they're on a very successful event in the banqueting hall last December, if any of you had the chance to see that. There are a few other references to care opinion, and another kind of mechanism we use for kind of getting the voice of folk in the system, and that basically is a summary of what's in the report. If there's any detail you want to find out more about, please ask.
Okay, thank you. Ross Clark.
Thank you, Chair, and thank you very much for that comprehensive report. There's certainly lots and lots of good work going on. And I know we're just about to move on to a presentation on technology-enabled care. I think it's also important to kind of point out the information in 5.1.4.3 and the case studies within that help to show the success of Blantyre Life in that technology-enabled care. In particular, looking at case example 2, the person says, the facility is of course incredible and while it feels wrong to say it's just bricks and mortar, without the health and social care staff, it would be, they here are phenomenal, they are this place's beating heart and it'll always have a place in mine. That's a very, very touching statement there and goes to show how valued our health and social care staff are by the people they look after. So I think it's important that their incredible hard work is recognised and appreciated, and obviously, compensated fairly in terms of pay and so on. But I think it's good that we highlight kind of the good work of the staff there.
Thank you, Ross. Martin?
I think I pushed the button by accident there in terms of my mic, so yeah, you can disregard that.
Okay, thank you very much. Kirsten?
Thank you. It's hard to summarise such a huge, diverse range of work. Just to thank you for everything that you do in social work and all this range of work that you're doing. A very quick question. Having put in a few requests to the unpaid work service, I've got the feeling that they're oversubscribed. Would that be right? Because they're so popular.
Go back to the service manager to ask that question of Gillian Booth, but it is a very, very busy service, and I think with what's happening with the world of prisoner release and everything in the justice world, they will be getting more people coming into community orders in future, so they are busy, but I think they're busy recruiting new staff as well.
Okay, a wee update would be great.
I'll go back to Gillian and ask her specifically for increases in numbers.
Thank you very much, and thanks all for everything you do again.
Thank you, Kirsten. Any more questions? No? Okay, this was for noting. Okay. Go on to agenda item 6, technology-enabled care. We've got presentations by Jill O'Boyle, technology-enabled care service manager, Kerry Glancy, telehealth programme lead, and Amy Brown, telecare programme lead.
Thank you, Chair. This presentation just coming up. Right, thank you. Done the introductions for us. I'm Jill O'Boyle, Technology-Enabled Care Service Manager. I've got Amy Brown sitting beside me, who is the lead for telecare, and Kerry Glancy, who's the lead for telehealth programme. Next slide, please. So, technology-enabled care is all about empowering people to live their best lives. It gives people more choice, control, and confidence in managing their health and well-being. Whether it's staying safe at home or accessing services remotely, technology-enabled care helps people to remain independent and connected to the support that they need when they need it. Our tech team is an integrated health and social work team, and one of the big benefits of that is we've got a wide range of backgrounds, lots of different skills and experience. And that really enables us to come together and provide a seamless, person-centred approach that's tailored to the individual's needs. We've got 3 core programmes that we deliver technology-enabled care through. First one is telecare, headed up by Amy. That's a South Lanarkshire only programme, and it supports people at home with devices like the Community Alert Alarm and Falls Detector. We've got the telehealth programme, that's South Lanarkshire and North Lanarkshire, and that enables remote health monitoring of health conditions and video consultations with clinicians, which reduces the need for hospital visits and helps people to better self-manage their own conditions. And we've got our Innovations and Solutions programme, and that's really our forward-looking programme of the future, I suppose, where we're exploring new technologies and the use of data in our programmes. On top of those 3 programmes, we've also got 3 current priorities. First one being Care Surround, which is our Amazon Healthcare project. That's a cutting-edge project we're working on with other local authorities, Census, the Digital Office, Scottish Enterprise, and a range of other partners. And we're really aiming to use smart technology to enhance individuals' health and well-being. The second priority for us is really focusing on patient and service user engagement. We really want to and do our very best to involve people in shaping the service, our service that they use. And finally, digital inclusion is one of our major priorities. Although we're a technology-enabled care service, we want to ensure no one's left behind as we move towards more digital ways of delivering care. Next slide, please. So the Tech Zone in Blantyre Life is our innovation space. It's open to the public, Monday to Friday, 9 AM to 4 PM, excluding public holidays. It's a welcoming, friendly, hands-on environment where visitors can explore technology-enabled care. They can test out tech, they can ask our team for advice and support. There's always 2 of the tech team on hand to provide that support in the Tech Zone. The space was co-designed with a wide range of key stakeholders, including carers, staff, service users, and the wider public. Glasgow Science Centre was contracted to translate those insights that we gathered into the tech, which focuses on staying connected, supporting carers, enhancing safety, and promoting independent living. Anybody can drop in and visit us, or they can make an appointment if they've got a more in-depth problem they want to talk about. We also deliver training from the Tech Zone as well. And we do that in person, or we can also do it on MS Teams, trying to make it as accessible as possible to as many people as possible. We also do outreach to our Blantyre Life technology-enabled homes tenants. They each had a welcome package of consumer technology, things like Alexa devices, smart plugs, smart bulbs, Ring video doorbells. And we're also very active in the localities. We attend events at hospitals. We're often running stalls at the front door of the Lanarkshire hospitals. We go to events in locality. We visit specific groups. We're open to visiting any group if people are interested. A major milestone for us this year was the rollout of the Care Surround project. So we rolled that out to Blantyre Life's intermediate care in March 2025. And it really is a big step forward for us in South Lanarkshire in smart healthcare environment. Early feedback has been really positive, with service users already reporting that they're benefiting from using Alexa devices for medication reminders. They very much enjoy hearing what is the daily cafe special, and people are listening to the music that they enjoy the most. We do recognise that not everybody is tech savvy and not everybody has friends and family who can provide them with technical support. So we are very much working with the third sector to try and build that capacity within the community. We've been working with AbilityNet, who have volunteers who can help people to build confidence with technology. We'll also be training our technology installers who are very busy on our analogue to digital programme. Amy's going to talk about that. They're going to be finished very, very soon. And we're going to slightly refocus their role to provide digital skills support as well. And finally, for this section, we are always listening. We always want to get feedback. We've got all sorts of different formats that people can contact us. We have old style suggestion boxes, we do service user phone calls, we've got QR codes, all sorts of things at Blantyre Life, hopefully making it easier for people to share their thoughts with us. And I'm going to pass to Amy. Next slide, please.
Thank you, Jill. Just in regards to telecare, it's a range of alarms and sensors that help citizens to live safe, well and independently at home. Sensors include such things as fall detectors, fire detection, carbon monoxide alarms, property exit sensors and GPS locators, just to name a few. Telecare alarms and sensors can call for assistance if anybody needs help. They provide real reassurance to family and loved ones. In terms of analogue to digital transformation, we've actually got about 7,000 community alarm service users in South Lanarkshire, so one of the nearly the biggest in Scotland. But we've actually got 6,000 service users already transitioned to digital alarms. We've got 500 alarms left because we've got 500 service users, about approximately that are husbands, wives and partners of those within their homes. So 500 left to go, and we hope to get that done by July 2025. So all the digital alarms come with SIM cards included in the alarms themselves, which means that no one's left behind when it comes to the community alarm service digital transformation. South Lanarkshire now is fully end-to-end digital. We went end-to-end digital in January 2025. But that means as well, in terms of the digital transformation, we've got like telecare for analogue, but the digital transformation means that we can actually look at a new infrastructure that allows a more tailored solution and more proactive solution for service users that might be at higher risk in adverse outcomes as well. In terms of our telecare assessments, we evaluate citizens' needs and risks through a telecare assessment, which is done by our social work assessors, and it's a tailored solution for them. But demand for our telecare has increased year on year, and we have approved approximately 2,500 telecare assessments last year. Last financial year, it works out about 209 assessments a month. 36% of them were also actually urgent telecare assessments, which means it's for hospital discharges, adult support and protection, or end-of-life care for service users. In terms of ongoing demand and rapid response, 15%, as you can see in the chart, were helping hospital discharges, and essential for hospital discharges were done within 24 hours of their telecare assessment. We had that installed done. But urgents we usually do within 2 to 3 working days, and standard within our 10 working days, no matter where you stay in South Lanarkshire. As Jill rightly said, service user engagement is crucial for us. As you can see with some of the quotes on the presentation here, what we want to do is ensure that the telecare and the telecare service and community alarm service is fit for purpose and it improves quality of life. So what we continue to do is look at to see what better outcomes we can achieve by service users, and why obviously the service is important for them, and why we want to do that is to improve health and wellbeing outcomes for service users. But we also want feedback for improvement for our service, and that's why we want to adapt to obviously changing needs and risks over time. So we do service user calls, and we get that feedback for service users in terms of involving them in that service provision as well, so that we're building the new technology with them, not for them. And I'll just pass you back to Jill. Next slide, please.
Just very quickly highlighting the connected care homes. Oh, rookie error, apologies. Just highlighting the connected care homes programme. It's not led by our team, it's led by Michelle McConaughey, Service Manager, who unfortunately couldn't be with us today, but just highlighting the pilots underway in David Walker Gardens. There's smart homes in each of the bedrooms, and that enables the service users to video connect with their family members, reducing social isolation and improving well-being. And the evaluation is being worked on at the moment. Next slide, please. And over to Kerry.
Thanks, Jill. So this is our tech roadmap. It's kind of showing where we are now and where we want to be. So where we are now, we've got the digital community alarm service, digital alarm receiving centre innovation platform. We have standalone remote health monitoring pathways, and we have service opt-in near-me video consultations. So remote health monitoring pathways and near-me video consultations fall under the remit of the telehealth programme. We have 2 work streams, which are Connect Me and Near Me. Connect Me is the name for a variety of NHS Scotland remote health monitoring pathways that may be offered as an option for a patient to interact or communicate information with their healthcare professional. So Connect Me service uses a patient's own device and is free of charge. Text messages are prepaid. There is an online platform available, there's an app, and on some pathways you have the option of a landline. It helps individuals to safely self-manage their condition from home or wherever is convenient for them. And people who have used the service report to feel empowered and reassured, and at most occasions it's more convenient for them. Connect Me also allows clinicians to remotely monitor their patients over time and be alerted to a deterioration of a condition and lets them act sooner. So in Lanarkshire we've had over 30,000 people use remote health pathways, and 22,000 of those were for blood pressure monitoring alone. Evaluation of our blood pressure pathway shows that 3 to 4 general practice appointments are saved for every person onboarded onto our Connect Me system, which is easing the pressure on primary care. It costs £16 per person per year, compared to approximately £25 per practice nurse appointment. So it's the benefits to patients though that are substantial. So there are more accurate readings taken in the comfort of their own home, reducing the impact of white coat syndrome. saves time and travel costs, particularly for people who may have mobility or transport issues. They get a better understanding of their condition and how to manage it, and we're leading to improved health outcomes. For Near Me, so that's a video consultation service enabling people to have a health or social care appointment from home or wherever is convenient for them. It's safe and secure and approved for use by Scottish Government and NHS Scotland, and to date there have been over 250,000 video consultations in Lanarkshire. We had 25,500 in the last year alone, and we have 251 waiting areas online to accommodate them. So we're aware that not everyone has or will have a suitable device at home with a camera or Wi-Fi to enable a video consultation. So to be digitally inclusive, we collaborated with community facilities across Lanarkshire, and we set up what we call Near Me, Near You hubs. So we have 12 of these hubs, and essentially it's a community building with a quiet, private space, with a suitable device with camera, and it's enabled for a Near Me consultation. There's a member of staff on the facility who can support the person to join the call as well. They've been trained by our team. So at the end of every Near Me consultation, a patient would be asked to complete a survey on their experience of using Near Me. So we kind of gather this data every 6 months, and for most people it's a 4 or 5-star service. Some find it invaluable, particularly those who are housebound or have mobility or transport issues. We have patient information leaflets available in 34 different languages. What we're trying to do is enable people to have more accessible and empowering care that is convenient for them wherever they are. So how we will get there, we're talking care surround, the Internet of Things, medication reminding and telehealth. We're involved in the No Need to Evolve projects. We have the tech zone, as Jill and Amy both mentioned, co-design, stakeholder engagement, and we offer the training. The journey, it's celebrating and recognising the successes that we have. Again, recognising and understanding the challenges we face, which inform the lessons learned, and sharing their experiences. Where we want to be is integrated care solutions using data to provide proactive support, encourage self-management and prevention, focus on family-first approaches, and as Jill mentioned, leaving no one behind. Thanks. Next slide. Thank you.
And just as we were mentioning before, we thought it would be quite helpful to not give our voice, but give a voice a story that we've obviously helped support someone their entire life. So Susan experienced a fall. She actually broke her shoulder, ended up with a stay in hospital, and she suffered some delirium, bit of confusion, etc. as well. And her husband, Stuart, who worked part-time, was really, really worried about her safety when she was at home alone. The occupational therapist was involved in their case as well, brought both Susan and Stuart into Blantyre Life to look at the technology and come in and visited the tech team there. Following their assessment as well, they were given a community alarm, and that was installed, and obviously a package of care for personal care for Susan, just to support her with her broken shoulder. But during that, obviously, visit to the tech zone as well, they were showed the video drop-in call and how you can use that through the Amazon Alexa. And that meant that Stuart could use his mobile phone anywhere he was to drop in and Susan at any time, just to see how she was, and also a reminder to take her medication. So that allowed then him to take that responsibility on. It wasn't involved in the actual care package itself, but also give Stuart as her carer that real reassurance that he could phone her at any time as well. And she also had the community alarm service. After 8 weeks, she was also reassessed. She no longer needed a care package, but he was able to continue to provide that medication support. They come back into the tech zone again because they were interested in the smartwatches that they'd seen when they were there. So when they come back in, they looked at the smartwatches again, were given some information just to allow them to make an informed choice of what actual tech that they wanted to buy in terms of the smartwatches. They went home, bought some of their own as well, and actually then started to use it and get a bit competitive with it. I'm not going to lie, with their step counters, etc. So, but also went to put medication reminders on their smartwatches because they were not always at home, and that allowed the both of them to actually monitor their medication taking, because Stuart was conscious of the fact that he wasn't taking his medication at the times as well. So that was really invaluable for them as well. But Susan obviously felt more safer and comfortable having her community alarm service. She was actually able to go in and shower and our pendant, obviously, she was able to keep that on in the shower. That made her feel more safe and comfortable at home as well. And obviously, Stuart was saying it was such a positive impact in their health and well-being as well. And now Susan's actually part of a walking community as well with women in our local community. So it's really allowed her to get back out there with her friends as well. Next slide, please. And that's all. Thanks so much for listening. Any questions?
Okay. Any questions? Grant?
Hi there. Thank you very much. Thanks, Chair. No, thank you for that report. That's fantastic. Now, obviously, with the analog to digital, I think it's a very, very positive thing. Now, I've been thinking, obviously, the relationship, but what happens with deaf BSL users? It's just within that situation, how do we support, or how can we support deaf BSL users? Now, we do, obviously it's a hearing world, and technology is skewed towards hearing, but then you've got supporting for deaf BSL users. I don't know if there's anything in place for that, or it's something that you will be looking into, or something for the future to think about. Thank you.
Yeah, thank you for your question. It is something that we are looking at. The Care Surround uses Alexa show devices, which have a video screen. They already provide closed captioning on that, so we're having a look at that. But as a consortium, we're very much looking at how would somebody who finds either reading, where they've got a hearing issue or whether they have got a visual problem, how would they actually use that technology? Because we want to be able to allow everybody to use the technology. We want to enable that. We want to make it as inclusive as possible. We met with Alexa colleagues last week and asked exactly your question. How would we support BSL users to effectively use the technology? And it will be something that we're really closely looking at.
That's great. No, thank you very much. Thanks for that. What was interesting when you're talking about closed captions? An interesting thing there is obviously with deaf people, especially the BSL community, don't. Is if you're maybe elderly and English has been your first language, then closed captions is absolutely fine. But for a lot of the deaf community, the BSL being their first language isn't their first. BSL is their first language, and closed captions will be. And a lot of deaf people will actually maybe struggle to read. So something to maybe to think about, and actually how do we support, I suppose, deaf BSL users? If there's somebody, a member of staff looking to. I don't know if it's a training issue. We need to get people trained up in sign language or something. It's definitely something to bear in mind and have that context of having, of the way that language is used in tech. Because obviously with a deaf person who's looking to make an emergency call, they want to make the call, but they use sign language. So how do they get that message across to a hearing member of staff? As for the community alarm system, that's another situation that I think staff need a bit of training in how to deal with calls from deaf BSL users. So it's something to bear in mind, but I really appreciate your time with the report.
Thank you, and thank you for your very helpful feedback. I'd really like to connect with you if that would be okay.
Okay. Any more questions?
Absolutely, no problem at all. Thank you.
Sorry, Grant. Sorry for cutting you off. Thanks a lot, Grant. Any more questions?
Yeah. Barry, you need to press your mic so the others can hear you.
Within the body of the report, there was a reference to the See Here strategy, and it did make reference to the BSL plan that we have in place. That's where we're trying to kind of communicate with the wider deaf and hard of hearing and visually impaired community. Unfortunately, Scottish Government are not going to renew that strategy. We got a letter in December from Scottish Government saying they're looking to mainstream everything. But there was an interesting meeting of the See Here strategy group last week, I think, where those people involved in that work want to continue that work, no matter if Scottish Government are saying it's not a good idea, because we're very conscious of that community are kind of left behind. That's why I made reference to the Carers Week video going up, BSL sign language on our web pages now, so that people can interact with our information. So if there's any connections, Jill, that we can make from our team to your team as well, and Alison's team, we'd be happy to support that.
Okay. Thank you. Grant?
No, it was just, I think the button was just left on there, so we don't, everything's done. Thank you very much, Chair.
Okay, thank you. Okay, can I ask the forum to note this presentation? Thank you very much. Okay. Over in the previous agenda item, I meant to say to Martin that you can go if you want to go, Martin. It's in my notes that. Okay. Thank you very much. Bye-bye. Okay. Agenda item 7 is mainstream equality. Equality outcome 1, increase ethnic minority representation action plan 2025 to 2029. It's on pages 53 to 56. And can I ask Alison Bell to speak to the report, please?
Okay, thank you, Chair. Good afternoon, everybody. This is the action plan that goes along with our mainstreaming equalities outcomes. We have just set the outcomes for 25-29. It's a long-term outcome plan. And one of the outcomes that we have is to increase the ethnic minority representation within South Lanarkshire Council. So the plan itself sets out 5 actions that we are going to be taking to try to improve the representation from minority ethnic community members. Don't intend to go through the whole thing, and if there's any questions I can take them. Action 1 is to review our recruitment processes, and as you can see from the current activity, we review recruitment activities on a regular basis, and we also ask people who are applying for jobs to complete an quality monitoring form. This is a purely voluntary completion. Some people will do it and some people won't, but in the main, we do get quite a high number of people who are completing. And if you back to the very first report that was presented to the forum this afternoon, you'll see at Appendix 14 of that report that Elaine presented, there are the figures there, the recruitment figures, and it shows you the figures between January to March 25 compared with January to March 24. And you'll see there that the number of applicants from black and ethnic minority backgrounds has increased quite significantly, going from 385 up to 1,010. You can also see the number of applicants that were then interviewed and the numbers that were appointed. So we're going in the right direction with this, but it's by no means perfect, so we still have a bit of work to be going on with. So this monitoring is, it's reported in the workforce monitoring, so the forum will be kept up to date with where we are, not just with black and minority ethnic applicants, but applicants from other protected characteristics as well. The council is working just now, we're using the Ethnic Minority Recruitment Toolkit, which was developed by the Scottish Government. This toolkit came about, it was through best practice, and it covers 5 equally important areas. So the strategic direction, what can we do to increase the numbers of people from black and minority ethnic backgrounds to be applying for jobs within the council, develop and embed capacity and capability, using data, which we've just referred to, advertising and engagement, and sifting and interviewing. So it goes through that process, and we have tried to include that within this plan. Now, to help us with this, the Council is currently represented on a national working group to develop an action guide for the recruitment and retention of BME teachers. And we intend to take that learning and put it into our recruitment processes going forward. As well as doing that, as I say, we review the recruitment processes, and we've introduced Oracle Recruitment Cloud, and that allows the Council to offer blind hiring. And what that does is it takes away all personal and demographic information from the hiring process, thus reducing any potential impact of unconscious bias, as well as obviously promoting a more diverse workforce. So we have already put things into practice. We just need to see whether or not, how quickly that comes through in the applications and appointments. Equally important in Action 2 is training for recruitment panels. Now, we have mandatory training for anyone who is taking part in a recruitment panel, and as well as all the recruitment practices and recruitment and the law, we we also include unconscious bias and diversity awareness training. So anybody who's taken part in a recruitment panel should have completed that training before they do so. You can see outlined the numbers of people who have undergone that training. In addition to the training that we also have the Council's Diversity Liaison Officers, and the Liaison Officers monitor recruitment, and they provide advice to managers on any equalities issues. They were previously referred to as Disability Liaison Officers, but obviously the remit has broadened, and they are Diversity Liaison Officers. Action 3 is to where possible, we're looking to have diverse interview panels. Now, that's not, it's a bit of a chicken and an egg, that one, because obviously we need people in post so that we can select for interview panels. So, where possible, we will include members on the panel who are from diverse backgrounds. And again, this will help to foster good relations and demonstrate commitment in diversity. Some of the feedback that we got when we did a focus group with unsuccessful candidates from black and minority ethnic backgrounds was that essentially they weren't seeing themselves represented on panels. So this is one of the things that we are looking to do, but obviously we might need to increase the workforce representation, and then that will give us a pool of people available to do this. Advertising, we have looked to increase where we're out there, how we're getting people to be aware of vacancies. All the council vacancies are advertised through My Job Scotland, and that can be accessed through the council website. We've also increased the use of social media to advertise job vacancies, and this includes using Facebook and Blue Sky. We no longer use Twitter for job vacancies. All job adverts, that go out say that South Lanarkshire is an equal opportunities employer, and that we welcome and encourage application from all members of the community. We do have additional wording, which is similar to this statement, on the apprenticeship opportunities, and we're going to look to include that within the mainstream job adverts, but that's something that will be done with the review of the recruitment policies. Any vacancies are they're shared with the diversity liaison officers, they're shared with the employee network. This is specifically for apprenticeships, and they're also shared with the refugee resettlement advisor as well, so that they can go out into the community. Action 5, which is on here, is to collaborate with community organisations. We don't necessarily work specifically with ethnic minority community groups or organisations, but we do have increasing numbers of participants on programmes and vacancies from ethnic minority backgrounds. And what we do is we try to let as many people know as possible. We will be looking to increase and improve our engagement with local communities. Again, it's finding the right people within South Lanarkshire to make that engagement with. So that's the plan going forward between 2025 and 2029. We will be required to formally report on this in 2 years' time. But it will be reviewed ongoing, and as you heard within the social work mainstreaming report, all the resources report on any contributions that they're making to the equality outcomes that we have within the mainstreaming report. Happy to take any questions.
Okay, are there any questions, Ross?
Thank you again, Chair, and again, thank you very much for the report. And again, certainly lots more work going on in the report, and generally on increasing representation of BAME communities within the council. I'd particularly like to highlight, though, Action 5, collaborate with community and organisations. In everything the council does, we should be seeking to work with and engaging with those with lived experience. So it's really good to see that we are doing that engagement with those communities rather than acting just on their behalf. So that engagement is very much welcome in this, and where it's also seen throughout other areas of the council. So more of a comment than a question.
Okay, thank you. Kirsten?
Thank you. Thanks again for the report. Clearly, diversity is a strength, that we need to make sure that our workforce reflects the population and use all the talents of all the population as well. Again, about Action 5, page 56, I just wanted to suggest a couple of organisations. West of Scotland Regional Equality Network, quite a widespread area, but maybe they're aware of more local networks in South Lanarkshire as well. And there's, in addition, it's the Vaslan New Scots Integration Network, have a lot of contacts with the New Scots as well. One group being the East Kilbride Integration Network, who might help you reach more groups who could benefit the council as well. Thank you.
Thank you very much. Tony?
Thanks very much, Chair. Hello, Alison. It's just to ask, I'm obviously representing the joint trade unions, and just to ask what sort of trade union involvement was there, and is there any way that there can be in the future for engaging with the employment of black and ethnic minorities? Alison.
Sorry, Tony, I didn't quite catch what your question was. Would you be able to? You're kind of breaking up a wee bit.
I think it was future engagement.
Yes, sorry, Alison. The question.
Future engagement with
unions.
Oh, with unions. As you know, Tony, anything that we do, we always involve union representation. We do that through the Equality and Diversity Working Group as well, as you're aware. So anything at all that we're doing, it will continue.
That's great. It's just to make sure that unions aren't forgot about, and I'm sure they're not, Alison, because as you say, I've been part of your integrated union committee. So yes, thanks for that.
Thank you very much, Tony. Okay. Before I go further with this, I'd like to congratulate the officers. That's quite a few years of good work you have been doing to get to where we are, and I'd like to applaud you for that. So we'll ask the forum to agree the action plan. Okay. And there's no urgent item of business, so thank you very much. We'll close this meeting.
Thank you.